Hello guys, welcome to my YouTube channel. In this video I am going to discuss about the health assessment in community. So guys, let's start. At first we will know the definition of health assessment. Health assessment is an organized systemic assessment of human body to determine the general physical and mental condition of the body by collecting both subjective data and objective data. Another one definition is health assessment is a process to collect subjective data through interviewing the client and obtain objective data by physically examining the client. Next, come to the point purposes of health assessment. Number 1, to collect data about physical, mental and social well-being of the client. Number 2, to identify problems in early stage. Number 3, to collect data systematically, both subjective and objective data. Number 4, to determine the causes of diseases. Number 5, to identify the client's strength, weakness and knowledge. Next, the advantages of health assessment. Number 1, it provides knowledge of the health status of individual, family and community. Number 2, it provides an opportunity to the community health nurse to have direct interaction with the people of different age group in community. Number 3, it helps in early diagnosis of the disorder or diseases. Number 4, it helps to identify the health problem of the community and getting information to prepare the plan. Number 5, it helps the community health nurse to acquire knowledge of the health status of community. Number 6, it helps to impart health education and protection against diseases. Number 7, it helps to develop good relationship with the community people. Next, come to the point components of health assessment. There are two components of health assessment. Number 1, history collection and number 2, physical examination. Now we will learn about the history collection. It is a collection of subjective data in details regarding patient's health in a chronological order, or it is a collection of information about the person, his family, socio-economic background, nutritional status, previous medical and surgical history, any accidental history and present illness. Next, we will discuss about the format of history collection. As a community health nurse, you should collect almost 6 types of history from the client. Number 1, biographic data. Number 2, chief complaint. Number 3, past and present history. Number 4, family history. Number 5, socio-economic history. And number 6, personal history. In biographic data, you have to know the client's name, age, sex, marital status, address, religion, nationality and diagnosis. Next, chief complaint. Chief complaint means the present complaint of the client about his or her health status. For an example, suppose client says, I am suffering from headache, high fever, cold and cough, etc. for few days. According to the client's statement, you must record it in format like that patient is suffering from fever, headache, cold and cough for last few days. Next, present and past history of illness. There are two different things in this, medical history of illness and surgical history of illness. Present medical history means client is suffering from a disease till now. This disease may be diagnosed in any time, maybe few days ago or few months ago or maybe few years ago, but it must assure that client is suffering from the disease till now. For an example, client is suffering from type 2 diabetes mellitus since last 6 years. Next, present surgical history. If patient has any history of surgery within few months, you should mention it in format, or if there is no history of surgery, you must write no significant history in this format. Next, past medical history. If client was suffering from any disease in past, but now he or she has recovered from that. Suppose client says, I was suffering from tuberculosis almost 2 years ago, but now I am fully fit and fine. So you have to write it in format. Client has a history of tuberculosis almost 2 years ago. Next, past surgical history. If client has any history of surgery in past almost 6 months to 1 year ago, mention it in format. and if no history present, you must write no significant history present. Next, family history, which included types of family, that means nuclear family or joint family, number of family member, etc. After that, there is a table in which you have to write name of the family member, age, sex, relationship with the patient, education and occupation, health status, etc. After fill up this table, you must draw a family tree. Next, socio-economic history. In this, you have to collect data about annual income, type of house, kacha or paka, water supply present or absent, electric supply present or absent, cross ventilation present or absent, etc. And last, personal history, which included sleeping pattern, adequate or not, eating pattern, vegetarian or non-vegetarian, bowel and bladder pattern, normal or abnormal, hobby, bad habits like alcoholism, smoking, etc. present or not, any allergy present or not, etc. This is all about the history taking. Another one component of the health assessment is physical examination, which we'll discuss in the next video. Thanks for watching this video. If you are new in my channel, please subscribe.